Good evening, friends. See, today want to convey something which is very important in the sense that in the present COVID scenario where people are getting vaccinated, so this is something which people getting vaccinated as well as others need to know. One thing is, I came across those thing posts in Times of India today. COVID virus mutating faster than before. IISc scientists. Three Bengaluru isolates more than 11 mutations per sample. This is a study. This is one thing. So it has started mutating very fast. Because understandable. See, it is a living organism. Survival of the fittest. Not only for human beings, the virus is also trying to survive. When we are breaking the chain, very important with vaccines now which is available, God's grace and thanks, kudos to all these people, especially our scientists, who, because India has become the highest exporter, manufacturer and exporters of this COVID vaccine today. Hats off, leave the political part. Let them carry on with their natak, it doesn't matter. The second this thing is from vaccination is not the end of COVID-19 story. CCMB director, that is the director of CSIR, Center for Cellular and Molecular Biology, Dr. Rakesh Misra, wonderfully put. Why I am telling this is that I don't know how many of you all have gone through this because I feel that the government is not being transparent of late, especially the state government here. Because a lot of cases we are seeing now. Cases, it is on the rise. We don't know whether it's a new strain, but still, a lot of cases. There are, at present, according to him, around 1 million active cases in India. So you can imagine the faster this thing of mutation happening, where this can lead to. Let us not be frightened, but let us be practical. One thing is that this is not the vaccination is not the end of COVID-19 story. This is very important because people tend to think, I have spoken to a few, is that vaccination I have taken, then fine. It's not fine. It's not enough. 85% are protected by the vaccine, right. 15% are vulnerable. Of the 85%, it takes about 2 weeks for the first dose to trigger immunity and 45 days for the second dose to build up on that immune response. So on the basis, basically if you take around 45 days for immunity to develop in the 85% in whom the vaccine works. So during this period, people having had the vaccine are vulnerable. One. Second, we don't know how long the effect of the vaccine will be. It might be a few months only. Probably, let us hope that is a couple of years, giving us time to produce another vaccine which is effective against the newer strains, especially, God forbid, those strains which turn virulent. Can happen. It is the virus trying to survive. So this we have to be very vigilant. So if I say that I have had my vaccine, I have had my second dose and I can do whatever I want, it's not done. You're still in danger, and then if you catch an infection, we'll start blaming what vaccine has done, what the government has done. No, it is in individual hands still as it was in the beginning. Protection by social distancing, masks, whatever, needs to be continued. Of course, after taking a vaccine and then if it is effective, those things you can relax a bit, go around, because it is bound to happen. People have been kept under lock and key for a long time themselves, by themselves or by initial lockdown period or whatever. But if it, as it is going on and on, it is natural for public to relax and say, whatever happens, let it happen. But then, when you are telling that, don't be under the illusion that the vaccine will give you total protection all the time. No, we really don't know. So we have taken the vaccine, thank God. We are a bit more protected than others, fine. How long we don't know. And it is a puzzle. So that we have got to accept and then keep going. It's very important. And lot of active cases. Again, like before, if you have got symptoms, contact your doctor. Don't be frightened. Isolate yourself. We are trying to break the chain. the viral chain spread. Once this is broken through vaccination, then I hope that, like what happened in 1921, the influenza virus pandemic, which killed millions across the world, even when there was not so much of travel, international travel, it has now become a docile virus, the influenza virus, but that still kills. We are seeing a lot of diabetic patients, or doctors, my colleagues in the ICU, etc., will know influenza leading to pneumonia and then deaths, ventilator deaths, because that has been there for a long period, not giving that much of importance or thinking much about it. But here again, we are thinking because it's something new and has been spread. We have been telling even those believers, gods, archagas, everybody, they have been telling more number of times the word COVID, coronavirus than chanting about God. That is about it. So the thing is, we have got to be vigilant. Please take the vaccination. Try to break the chain. If you have got symptoms, still contact your doctor. Don't get panicked. Isolate yourself. Keep away. Especially people from northern states, Maharashtra and Kerala coming in. At least the government now has put a quarantine thing. And international travel, where mutants are, they have now restricted entry or doing whatever. But we have got to do our part. So let us not live under delusion. COVID is still here. It is going to stay. Hopefully we get this thing by individually and with the help of vaccines and everything, get this disease under control and see that the mutations become really mute and disappear, or not disappear, or not that problematic like the present influenza virus. Hope it happens. So hope I've made a little sense in this. So please give a thought to this and then do take care of yourself. And the vaccines are safe. I have had my second dose today, nothing. Oh, of course, some body pains and other things will be there. That will be there with any vaccine, fever. So that clears. So that is the maximum with this. That is there with any vaccines. Then in that case, you will avoid, and then will be totally chances of getting exposed and having a lot of further problems are there. It's for individuals to decide and choose. I mean, practically think about it and decide. Hope you have a nice weekend.